Hello, dear viewers. Today, we will focus on an important issue that threatens our health: smoking and its harms to our body. I am an expert who shares information on coach, life coach, and health issues, and today we will examine in detail the damage that smoking does to our bodies.
In fact, smoking can be considered as old as human history.
Cigarettes, which contain more than 6,000 harmful substances other than nicotine and cause more than 24 diseases, have been plaguing humanity for 4,000 years. Cigarettes, which were discovered by chance by a Mayan native, were a sign of wealth for a while and then became popular through mass production, are the main cause of preventable diseases, disability, and premature deaths. It would be in your best interest to quit smoking as soon as possible, which was seen as a peace pipe among the Indians, was a favorite of the Red Kit, and was sent to the soldiers during the campaigns during the Second World War. Spread your thoughts? If you are one of those who say easier said than done, you may be told at least reduce it, because the risk of cancer in light smokers reaches the same level as non-smokers within 10-15 years. At least smoke less and live a little longer. Cigarettes, which rank first among the most frequently consumed tobacco products worldwide, are one of the extremely harmful habits that cause the death of more than 5 million people every year. So I can hear you asking, what chemicals are in cigarettes that cause so many deaths? Cigarettes consist of at least 70% of chemicals known to cause cancer. The chemicals in cigarettes are called carcinogens that cause cancer. Some chemicals found in tobacco smoke are 1 nicotine, 2 hydrogen cyanide, 3 formaldehyde, 4 arsenic, 5 ammonia, 6 radioactive elements such as polonium-210, 7 benzene, 8 carbon monoxide, 9 polycyclic aromatic hydrocarbons. There are many more harmful substances that we cannot name. So how does smoking affect our health? As you can imagine, smoking affects our lungs the most. In case of smoking, various diseases occur in the respiratory tract and lungs. Among these, lung cancer, chronic bronchitis, asthma, various infections, and even allergic diseases. Studies have shown that these diseases are more common in smokers. What are the effects of smoking on the respiratory system? Substances in cigarette smoke cause inflammatory reactions in the respiratory tract, irritate the bronchi, and increase the tendency for infection. It damages the self-cleaning mechanism of the respiratory tract. Complaints of breathing difficulties, chronic cough, and phlegm are frequently encountered in individuals who smoke regularly. In addition, smoking blocks the heart vessels. While all tobacco products, especially cigarettes, cause atherosclerosis to occur, they also cause the disease to progress in patients with atherosclerosis. Another harm of smoking: it disrupts the fluidity of the blood and increases its tendency to clot. One of the most important questions is, how does smoking affect blood circulation? Smoking is one of the most important preventable causes of atherosclerosis. Smoking paves the way for harmful plaque formation and vascular occlusion, which hinders blood flow in blood vessels. It reduces the oxygen content of the blood and thereby affects the oxygenation of all organs. Despite all these bad situations, why do people become addicted to cigarettes? There are more than 4,000 chemicals in cigarette smoke that have carcinogenic properties. Nicotine, one of these substances, has severe addictive properties. Smoking causes physiological and psychological addiction. When the nicotine concentration in the blood decreases, withdrawal symptoms occur. Nicotine is absorbed in the lungs, and after absorption it goes to the brain through the blood. Approximately 10 seconds after smoking, it reaches the brain and releases dopamine. Nicotine addiction is so common because of the effects of a substance that reaches the brain so quickly. Of course, in addition to all these, smoking also has a negative effect on psychology. There are many answers to the question, how does smoking affect psychology? But we will discuss a few that stand out. Today, smoking is considered a disease because it causes addiction and is known to be psychologically transmitted. It is emphasized that smoking is more common in individuals with psychiatric disorders such as schizophrenia, anxiety, and anxiety disorders. Cigarettes, especially those that provide instant relief, continue to be indispensable for people today. However, whenever you experience withdrawal symptoms, mental distress begins to arise. Will we still be harmed even if we don't smoke? Of course, even if you do not smoke, exposure to smoke will harm you. Let's explain with examples. The risk of breast cancer increases by 60% by the age of 50 in women who are slightly and constantly exposed to cigarette smoke. Respiratory diseases. Exposure to cigarette smoke in the workplace or social environment causes COPD and adult asthma. Babies and children are most harmed by secondhand smoke. The situation is no different in adults. While the short-term effects of passive smoking are associated with eye, nose, and throat irritation, acute bronchitis, and pneumonia, the long-term effects are associated with chronic diseases such as cancer, cardiovascular diseases, chronic bronchitis, and emphysema. A smoker harms not only himself but also his life. A new report published by the World Health Organization, WHO, stated that smoking, which causes the death of approximately 7 million people every year, also causes great damage to the environment by causing deforestation, water and soil damage, and acidification. So can we quit the smoking habit? Let's take a look at the positive changes that will occur in our body if we stop smoking. After quitting smoking, blood flow in the brain also increases. This allows more oxygen and nutrients to reach the brain cells. This helps heal and rebuild cells in the brain. The effects of quitting smoking on the brain can begin within a few weeks. After 24 hours, the risk of heart attack, which increases with cigarette consumption, begins to decrease. After 48 hours, the senses of taste and smell improve. Lung capacity increases by 30% in 2 weeks. Between 1 and 9 months, healthier breathing is achieved, and the person feels much more energetic than before. If you are wondering how to quit smoking, I have a few suggestions for you. If you want to relieve the withdrawal symptoms that occur in your body when you start quitting smoking, milk and dairy products, which reduce the stress hormone in the body, also reduce the desire to smoke. You can consume yogurt, kefir, milk, and iron during the meal as you feel hungry. Absence of nicotine after smoking. You can supplement it with nicotine gum, sublingual tablets, or patches. If you want to quit smoking, make a plan about it. Be careful to exercise. Go for a walk. Chew gum to relieve withdrawal symptoms. Drink plenty of water. Try to relax by breathing deeply. And the most important thing, take care to spend time with friends and family members who do not smoke. Thank you for watching my video. Please share and like our video to raise awareness on this important issue. Stay away from smoking for a healthy life.